So now that we've learned a little bit about the history of mental illness, about sort of the introduction of the medical model, where we said, ooh, maybe mental illness is actually like a physiological condition that can be diagnosed, treated, and cured, we're just going to talk a little bit about how in modern days we attempt to classify mental illnesses. Because mental illnesses, like any type of physical disorder, have lots of different subcategories. We don't just diagnose someone as having a mental illness, we diagnose them as having an anxiety disorder or a mood disorder or a schizophrenic disorder. And so the first thing to just make sure we're thinking about is why it's important that we currently have a system to classify, that we don't just have like one big overarching category of like insanity, which by the way is not a psychiatric diagnosis, that's just a legal term, and instead we have subcategories. So the reason why that's important is because when you can classify something and separate it out into like groups, that allows you to very easily communicate important information without wasting a lot of time. And so people are able to conduct research on specific types of disorders really efficiently, as opposed to just researching mental illness and having like all these different types of illness and all these possible causes of all sorts of different things. We can say, well, let's categorize by symptoms that are the same. Let's try to think about what disorders might be caused by the same types of biological imbalances or by the same type of social factors. And so when you have a classification system like we do for mental illness, it allows us to make a diagnosis, to predict what will happen in someone's life. If someone's diagnosed as having depression, the outcomes of that for them are going to be very different as opposed to if they're diagnosed as having a phobia. And a doctor, knowing that someone has bipolar disorder, is going to be able to prescribe a method of treatment that's very different from if they were to diagnose someone as having schizophrenia. And then the way that psychologists diagnose currently in the United States is they use what's called the DSM-5. DSM stands for, it's a very long name, the Diagnostic and Statistical Manual of Mental Disorders. The 5 means it's in the 5th edition. The editions of the DSM are not the same as like the editions of your textbook. I know for a lot of you, when you have to buy textbooks, you wonder, well, is like the 8th edition or the 9th edition like that different? And honestly, for textbooks, they're not always. But with the DSM, they don't release the new edition like every year. It actually, they've only had 5 since it's been around, and this has been around since I believe the 60s or the 70s. History's not my thing. But when they release a new edition, it's because there's this massive overhaul that has been done. And so the 5th edition was just released within the past decade, and it was a really, really big change. There were a lot of disorders that were recategorized. There were some disorders that were introduced. There were some that actually were eliminated. And what the DSM-5 gives us is a manual to follow to make diagnosis. So if you were to look through the DSM-5, you would see, hundreds of different disorders listed. And then the information that's included under each disorder is what that disorder looks like. So it's a list of symptoms. A lot of times it will say, major depressive disorder. Patient exhibits 5 of the following symptoms for 2 or more weeks at a time. And then there's a whole lot of different symptoms that are listed. And they're pretty like objective things. Patient reports feelings of worthlessness. Patient's energy levels are low. And so they're just very factual symptoms that a psychologist is going to look at, almost like a checklist. And the reason why the DSM-5 is set up in the way that it's set up is so that hopefully diagnosis is really reliable from person to person. And what I mean by that is someone should be able to go to a psychologist in New York, present with their symptoms, and then go to a psychologist in California, present their symptoms, and still receive the same diagnosis. The DSM-5 doesn't attempt to explain why disorders happen. It doesn't say that depression is caused by a serotonin imbalance in the brain. It doesn't say that schizophrenia is caused by too much dopamine. Instead, the DSM-5 says, we're not 100% sure what causes these disorders, but let's at the very least agree how we can diagnose them. And so that need to come up with a reliable diagnosis has driven this like symptom first use of the DSM-5, or the symptom first structure of the DSM-5. And then other reasons why it's important to have a diagnostic tool. One, for just very real world applications. If you want to go receive psychiatric help, medication needs to be prescribed, you want to go to counseling. A lot of times, in order for insurance to pay for some of that, you need to have an official diagnosis. So that helps a lot of people. And then, as I said, the DSM-5, it really isn't attempting to explain disorders. There's still a lot we have to do to learn about what causes them. But it says, well, if we can at least describe them, sort of like the trait perspective, if we can at least describe them and come up with a common vocabulary, that will allow us to help people as best we can.